Hello, I'm Nick O'Shea and I'm the Chief Economist at the Centre for Mental Health. Today I'm going to talk to you very briefly about Bringing Care Back Home, which is a new report that we've just launched around provider collaboratives, or new care models as they were known at the time. This is about finding new ways to offer care and treatment closer to home, and in this case for young people. So saying, if you're in an out of area acute bed because you've got a mental illness, can we treat you in the community and bring you back much closer to home? So the key thing to say is that whilst this is an economic report, we're very clear that the clinical primacy has been the key thing. So making sure that what happens to those young people in all the areas we looked at, it was the clinical decision and the outcome is what mattered. The economics, which is naturally going to be my area of interest, comes along second. Now, in terms of those economics, it's really worth pointing out that what they've all done is to look at a small group of people, say 30 or 40 tended to be the size in each area, of people who cost a lot of money, and really just to ask the question, we're spending high levels of money, so between 200,000 and 500,000 roughly on each person. Can we do something different that improves their outcomes and also gives them a better experience of the treatment that they're going to receive? And the answer was, well, yes, and when you look at actually what these 6 areas were able to achieve, £15.3 million worth of savings from just under 250 people in the course of a year is quite extraordinary. And we look at things such as the provision of community care, which has enabled them to bring people back into the area, and just really having that focus on that young person and saying, where is it best that they're treated? As well as the numbers, there's always numbers and bar graphs, we also look at some of the qualitative findings within the report, about how the models have worked, and looking at what it takes to make change happen. You have to be tough and you have to be robust, and bringing your experience to make sure that actually things can change, and that taking new decisions and positive risk taking are things that can happen, and how you need management and governance to stand in behind you to enable those things to be possible. So I hope you enjoy the report. It's a really serious, it's a really challenging issue, and it's something that affects young people, so it's something that's really, really key.